Welcome to Nautilus TV. I'm Deborah McPherson, web editor at Nautilus International. Today we're joined by Dr. Kelly Gerakoudi, Assistant Professor of Shipping Management at the American College of Greece. Welcome, Kelly.
Hi, Deborah. Thank you for having me.
So let's talk about this deep vein thrombosis research you are doing, which is what we're here to talk about.
Mhm.
What is it all about?
Well, I am about to start with my co-author a new study, a new research paper, which will explore how telemedicine tools can help detect, manage, and prevent deep vein thrombosis among seafarers.
Okay, and why is this research necessary, do you think?
Because I met him once last during the summer, and he told me about his recent research activities, let's say. He's already exploring telemedicine tools among the general population. And right away, I thought about the seafarers. We have something like almost 2 million seafarers out there moving in international trade. And I thought that such tools, such applications would be very, very useful for them as well. In particular, because I think that they face unique health challenges. First of all, seafarers spend long periods at sea and they experience long watches with limited movement. Their cabins usually are small, so they have limited space for movement. Um, they usually experience and report dehydration and poor environmental conditions in several cases, such as heat, vibration, etc. So based on that, I thought that this type of research might be very, very useful for seafarers.
Right. So we don't know, though, yet if seafarers are more at risk of deep vein thrombosis than the general population.
Not just yet. That's why I need data, and I ask for your assistance as well. But given the long flights, because they travel throughout the year in order to reach the vessels, and the limited space within the vessel and the long standing during the watch hours, I think that this type of population might be even more susceptible to this type of disease.
Interesting. So it's not just the fact that on board a ship they're subjected to prolonged immobility and cramped conditions, but also dehydration, but also the actual travel to their destination ship.
Exactly. The goal of this study is to improve conditions for everyone, not attack anyone. I think that better healthcare for seafarers means fewer medical incidents, less vessel details, smoother operations, and I guess that this would be a win-win situation if we can manage to improve the welfare of seafarers and improve the standards for this. It's a win-win situation for companies, for seafarers, for crew members, for regulators, for unions, for everyone in the industry.
So tell us a bit more about your assistant professor role and its connection with the American College of Greece.
Well, I'm an assistant professor in shipping management at the American College of Greece. This is a very interesting program. We have a lot of students interested in the industry, and what I try to do is to spread my passion for the industry. I take a lot of initiatives, and as a matter of fact, I am really interested in the well-being and of seafarers. Um, I take all my classes to vessel visits. Earlier today, I took my introduction to shipping class on board. And we always discuss with seafarers because I want my students, although they study shipping management, I want them to be aware of the working and living environment of seafarers. And we always discuss, and they always devote their, personal time to chat with us, to explain, give us information, and they are always happy to see us on board. What I'm trying to say to do is to make my students empathize with the seafarers really understand the way that they work, the way they live on board. And if in the future they are called to manage seafarers, crew members, to be able to understand so that they can manage them in a more effective way.
Okay. And so are your students seafarers in training or other maritime students?
No, they study shipping management. It's more like management focused on the shipping industry. So
So,
they
so,
have no idea actually what a vessel is necessarily, or how a seafarer looks like, or what he does exactly.
so who's sponsoring the research?
Well, nobody is sponsoring this study. This is an investigator-initiated study, although we will examine a telemedicine application for deep vein thrombosis as a case study only. There is no funding for this research. So all the research concept, the research design, and the analysis of the research will be conducted solely by my academic team.
Ah, right. Interesting. So why the focus on telemedicine, do you think?
Because it is a modern way to democratize maritime healthcare. And from the time I listened to I heard of these new studies from my colleague, from my co-author, I immediately connected this idea with the well-being of seafarers. I'm really
Right.
interested to see what will be the potential of such applications.
And is your co-author a seafarer?
No, he's a doctor. Medicinal doctor, he's a surgeon, and he already conducts research about deep vein thrombosis. And my idea was to apply this type of research on seafarers, on this population. Because I've
Right.
made a small, research, and there are no many studies on this topic.
Thanks, Kelly. So how do seafarers take part in this research?
They can participate in this study by completing a very short and easy, user-friendly online questionnaire to share their own experience with swollen legs, leg pains, or deep vein thrombosis cases. And of course, my contact details will be available for anyone who would like to contact me directly. It's very easy.
Is there an age limit, or are you looking for any particular type of seafarers who want to
Just
take part?
serving seafarers, and every voice matters to our study. The aim of our study is to recognize, first of all, that deep vein thrombosis represents a real occupational risk for seafarers. Second, to prevent this type of disease. How? My dream might also be to modernize, to amend company practices and policies as far as seafarer healthcare is concerned, to develop, new steps about movement breaks, telemedicine checkups, or hydration policies.
So where will the survey be published?
Hopefully in an international peer-reviewed academic journal, and hopefully even presented in a conference, international conference, medicinal or shipping conference. And I would also like to make summaries available for shipping organizations, seafarer organizations, to so that the information is accessible to anyone interested.
Right. And as you've mentioned, you're hoping the findings will lead to help with policy amongst the various bodies. But
Yes, by all
can
means.
you elaborate a bit more about what you hope to achieve? And
Because if we show the necessity of taking more practical steps in this direction, and we actually, find that deep vein thrombosis represents an occupational risk for seafarers, for the seafaring population, then we should make a call towards the international regulatory bodies in the shipping industry and the major shipping companies to adopt new policies, to develop their existing seafarer welfare policies in this direction to prevent such cases.
okay, well, I wish you well, and we look forward to hearing the results. And hopefully, people will take part before the end of November for you, and they can find the link at the end of this video.
Thank you so much, Deborah, for having me.